Hello, hi, it's Dr. Erica. Thank you for joining me. I'm going to talk about 10 of the most important medications for allergy season. Allergy season is fast approaching with the change in weather and change in environment triggers, pollen concentration, things like that. So I'm going to briefly go over 10 products that I recommend. They'll include nasal sprays, topical nasal sprays, eye drops, as well as solutions for rash, also ear cleansers to help reduce mucus on the membrane of the ear, also antihistamine class 1 and class 4, class 3 as well and 2. So I have a few products, so stay with me to the end of the video. Again, this is Dr. Erica Onabola, pharmd. I am here to give some suggestions for you. Now, this list may be reduced or may be expanded, just depending on your particular situation. So please subscribe, like, and share as well. Okay, so let's jump into the video. We're going to talk about eardrops. Debrox is a brand name that helps to reduce the amount of earwax in the ear, cleanse the ear canal so that allergens do not get onto the eardrum, causing ear infection. Also, it's best to avoid swimming. When you're swimming, make sure you're drying out the ear afterwards with a hydrogen peroxide or a Debrox solution, which includes a peroxide as the active ingredient, and that is going to help push away fluids away from the eardrum. So do be aware of that as well. If you're a swimmer, Debrox might be good for you as well. So Debrox, I have the generic or off-brand version. Earwax removal. It comes with a bulb. Comes with the bulb, and it comes with the dropper as well. And the active ingredient is going to be peroxide. If you don't have Debrox or off-brand, there is regular hydrogen peroxide that works as well. Drop some in the ear, and it helps to remove water, helps to remove wax from the ear. And then you can place a cotton swab inside the ear to be sure that the solution it stays in the ear and it works well. Okay, I do suggest this for allergy season just because it's going to help reduce allergens that could get close to that eardrum, causing otitis media and ear infection. So I do recommend that. Okay, next I'm going to go on to talked about the nose, I'm going to go to the eye. Eye products will help with redness reduction, help with cleansing the eye mucous membrane, the conjunctive tissue as well, reducing the risk of inflammation there. And that is going to be tetrahydrozoline active ingredient to help with reduction of redness. Okay. As you can see, now this product is sterile. It comes with the eye drop, and it is recommended to be used for eye redness relief and eye irritation. Again, and you're going to place 1 to 2 drops to the affected eye 4 times a day, up to 4 times a day if needed. You want to open the lower eyelid, make a pocket, and you're going to look inside. You're going to look at the actual tip of the solution bottle, squeeze that bottle, hold the eyelid closed for about 1 minute to 3 minutes, and then you're going to open the eye again. And you can repeat that again up to 4 times a day. It should be good for patients, adults. Let's see if it's indicated for kids. The Debrox as well is indicated for children, so that is very important as well. Okay, it doesn't say whether it's for kids or not, but I would just use it for adults, maybe adolescents at the youngest age. Tetrahydrozoline, and that is going to be a 0.05% redness reliever. Okay. Okay, now Cystane is another brand that I recommend. It is a lubricant and it's an eye drop as well. Cystane. Okay, I'll leave the name in the description box, but do consider it as well as a lubricant for the eye to lubricate the eye throughout the day. I have a bottle of it. And it's long acting, and I do recommend it for just lubricating the eye, keeping the eye moist. We tend to, during allergy season, be outside a lot in the vicinity of pollens and grasses and weeds and things like that. So eye protection is very much important, especially using eye goggles to help with repelling those allergens from getting onto the mucous membrane. So I do recommend it, goggles as well as lubricant and redness eye reliefs as well. So those are very important, especially if you deal with allergic conjunctivitis, which is inflammation and swelling. Increased pressure of the eye can include ocular pain, also could be mucus relief and watery eye relief as well. And that preventative measures will help to reduce the need to go to the ophthalmologist for antibiotic therapy. So I do recommend that. Also, the products that I'm showing are over the counter, so you can just pick them up and use them. Okay, so next I'm going to go over medications that help with throat, itchy throat, help with sore throat, and that's going to be Chloraseptic, brand name. The active ingredient is going to be like analgesic or a pain reliever for sore throat, occasional minor irritation in the throat. It's a spray bottle and it can be used as well. Okay, and it is sugar-free, so diabetic patients will also be using this as a benefit as well. It's sugar-free. You don't swallow this after spraying. You just sit it on the back of the throat for maybe 10 seconds, and then you can gargle with it and then release it. You don't have to swallow it, okay? So I do suggest this as well for sore throat, irritation during allergy season. Okay, and it comes in different flavors, and again it's sugar free, so that is good as well. A good gargle, a good anesthetic for pain, sore throat, and it comes in a convenient spray bottle, so I do suggest it as well. Also for itchy throat, for sore irritated throat, antihistamines oral can be taken. And I'll go over antihistamines next as well. Since we're talking about that topic, there are different antihistamine classes. Benadryl is one. It's a first generation antihistamine. May cause some side effects such as drowsiness, sleepiness, uh, over drying of the mucous membranes, because that's how it's going to work. So by being a first generation is very strong, much stronger than the later generations. So if you're able to tolerate Benadryl, then I suggest it. But if you're going to be like handling heavy material, working, things like that, then I would suggest maybe a non-drowsy generation antihistamine, which is going to be like your Claritin and your Allegra. That's your loratadine. Also your cetirizine, which is your Zyrtec, which is still on the market over the counter that you can purchase as well. So the Benadryl is 125 or 25 milligram capsule. It comes in tablet form as well. It comes in children's liquid Benadryl for pediatric patients. And then it is, again, side effect of drowsiness, directions 1 to 2 of these capsules, particularly at a time. And then it's indicated for patients 6 to 12 to take 1 capsule. No more than 6 doses in a 24-hour period. So you're going to take it up to 4 to 6 times in a day. And this is 25 milligram capsule, and it does come in liquid form. I do suggest it and those who can tolerate that the offset side effect. Now I'll go over Claritin and Loratadine, 24-hour relief, non-drowsy. That means you can take it during the day and be okay. Now liquid gels usually is what it comes in. It's Loratadine 10 milligram for indoor and outdoor allergies, and this one is particularly indicated for allergies. So what it's going to do is help block the histamine receptor, so that the histamine is not activating the response. So it's blocking the histamine receptor, and so you get a little bit more relief, causing so you don't get that the side effects of the itchy, rashy type sensation. You'll get relief from sneezing, runny nose, also itchy throat and itchy nose and watery eyes. Okay, so it has some drowsiness side effect, but it's less because it's more of a current medication. Also, we have Allegra 24-hour relief. Allegra is a little bit more expensive, but it is on the market. It's more expensive because it lasts longer and the side effects are reduced. Okay, it's a 4th generation antihistamine. I do suggest it as well. Fexofenadine, 180 milligram. Fexofenadine is the generic or active ingredient. Okay, I do highly suggest it as well. Now we're moving on from the antihistamines for sore throat, runny eyes, itchy nose, itchy throat. I'm going to move on to the nasal spray for the help with breathing, help with opening and ventilating the airways, and that's going to be oxymetazoline. Oxymetazoline is comparable to Afrin on the market. Afrin is the brand name. And this is working up to 12 hours. Nasal decongestion is good for hay fever, upper respiratory allergies, and so forth. What it's going to do is going to constrict those blood vessels, stop the flow of blood to the nose so that you can breathe. The more blood flowing to the nose, the more congestion, the more instability in airflow. So I would suggest it, and it's good to take it for like 3 days up to 5 days. After about 5 days, your nose will begin to rebound, causing, again, the stuffiness. So I do recommend this for about 3 to 5 days. Take a medication holiday for about another 3 to 5 days, and then you can start again with taking it. So that's that's a known fact with nasal decongestion, so I do recommend it. Also, there's pseudoephedrine products, oral pseudoephedrine capsules for 4 to 6 hour relief, immediate relief, and then extended relief up to 12 hours. It's good in pregnancy, so I do recommend it in pregnant patients as well. And again, that's pseudoephedrine or products that are taken orally for congestion, nasal congestion as well. And they can be purchased at the pharmacy. Okay, calamine lotion. And so during allergy season, we go outside a lot. There's poison ivy, there's poison oak. There are so many different types of vegetative florals out there, weeds out there that our skin comes in contact with during summer and spring season. And because of that, our skin may develop rash or itchy symptoms to let us know that, hey, we've touched something that's considered an allergen. It's in the skin. The best way to get rid of it is to wash with soap and water. If there's no relief, then you can use an over-the-counter product, or you can go to the dermatologist or go to your doctor for something stronger, a stronger prescription. So I'm going to go over calamine lotion as well as Domboro, which is a solution product to help fight off the itch that could burrow down into the skin, causing redness and so forth, inflammation. So calamine lotion, I would suggest shaking it very well because it is a suspension. It's topical only, okay? And it's good for sumac, poison ivy, and poison oak. And it's called calamine lotion skin protectant. Okay, dries the oozing and weeping of those poison ivy, poison oak, and poison sumac. Okay, use as directed, avoiding contact with the eyes and mucous membranes, and it's good for those who are 2 years of age and older. Okay, so for those who are 2 years of age and older, shake it very well. Cleanse the skin again with soap and water. Let it dry, air dry before each use. Then you're going to apply the lotion using a cotton swab or soft cloth as needed for comforting. Well, I don't suggest it very much so, but it may be beneficial in those particular indicated cases. Using it off label, I would not suggest it. Like if you're just having a rash or that's not related to poison ivy or sumac, then I wouldn't suggest it because it doesn't work. I would only suggest it if you have been seriously in contact with some poison ivy or sumac or poison oak. Then I would definitely try it. But other than that, I wouldn't try for any other type of itchy or rash, chicken pox, things like that. No, I wouldn't use it for that because it doesn't work. There's no real relief. There's no real relief, and it's just a wasted product at that point. But I do suggest it if only there's a definite contact with vegetative product in the environment, such as a sumac, poison oak, or poison ivy. Okay. Now, this particular product, Domboro, is similar, and it has aluminum. It has zinc in it as well. Let me be sure about that. It does work against poison ivy, poison oak, sumac, insect bites, athlete's foot, rashes caused by soaps, detergents, cosmetics, and jewelry. So it works against products that do come into contact. It doesn't have to be in the outside allergens. It can be any type of allergen that you are coming into contact with. Okay, reducing redness, it stops oozing, and it aids in the healing process. Okay, and the active ingredient is going to be astringent products such as aluminum sulfate and also calcium acetate, and it's doctor recommended. Rash relief, I'll show it to you. So that is my suggestion. I do recommend this particular one as well. It is it actually is packets. There's packets inside, and you can use 3 packets and 16 ounces of cool or warm water, stirring fully dissolved. Do not strain. Apply mixture and use as a soak. Okay, so I would recommend it as well, Domboro. So those are the products that I have to show you for this particular allergy relief video. These are the top 10 that I would choose. Antihistamine orals, nasal decongestants, topical nasal decongestants, such as the oxymetazoline or Afrin, off-brand. Afrin is good as well. If you're into brand names, brand medications, I would suggest it as well. Also, Claritin, Benadryl, Allegra, eye lubrication, eye redness relief. All of those will come into play throughout the next season. And also, don't forget Debrox as well. Our ears are just as important as our eyes, our throat, so forth. The ears are also important. I do recommend peroxide for cleaning of wax and allergens off of the mucous membranes of the ear. Okay, so also there's throat relief. There's solution sprays for that. So do be on the know about that. And also there's the calamine lotion or suspension that is only indicated for use with those who have come into direct contact. So I do recommend those 10 products. If you have questions or comments, please let me know. Any topic suggestions, I'll be happy to work with you and help you answer any questions that I may have as well. Do be on the know about new content uploads weekly and daily. And I'm glad that you were able to join me. Please like, share, and subscribe. Thank you for joining me. I hope this was very helpful. Please visit my website as well. Bye-bye.